Well, warm welcome to this talk. Today we want to be looking at the antiviral effects of ivermectin. Now, we've been looking at various effects, potential anti-cancer effects of ivermectin over the past couple of weeks. But here we're looking at the antiviral effects, particularly the SARS coronavirus 2 antiviral effects. Now, this paper that I'm going to be reporting on today, let me just show you it. Here we have it here, randomised double-blind. Is a pilot randomised placebo-controlled double-blind trial of a single oral dose of ivermectin for post-exposure prophylaxis of SARS coronavirus 2. And here's the paper, actually quite a readable paper from Australia. Now, the interesting thing about this paper is the trial for this work began in 2021. It's just been published recently, towards the end of 2025. So all of 2022, all of 2023, all of 2024. What the heck is going on here? Why is it taking so long? Better late than never. Evidence for the antiviral effects of ivermectin is accumulating, and it is there. There's no question about it anymore, especially for the anti-COVID effects. Now, this study used a single dose. Let me just give you a bit of an introduction first of all, actually, to see if you want to want to listen. People who took one small dose of oral ivermectin after being exposed to the virus, so a family member, something like that, took longer to test positive and had more time alive and free from symptoms. So we're clearly seeing an antiviral effect. Multiple reports from in vitro infectious models document ivermectin's antiviral properties. But anyway, specifically in this trial, it took longer to test positive and had more time alive and free of symptoms. And we'll see why that's indicating antiviral effects. That's what this is about. Now, this is only giving one single dose after exposure. Now, the doctors we've been talking to recently who use ivermectin to treat COVID, these are the 12 milligram tablets. I'll show you them on the overhead. These are the 12 milligram tablets that I use from time to time. Ivermectin tablets, 12 milligrams. I'm not telling you what to do, of course, but these particular ones are from this Indian manufacturer here. 12 milligrams. But we were talking to Professor Clancy, for example, a few days ago. And when he got COVID, of course, we're not telling you what to do, but when he got COVID, he took two of these, 24 milligrams a day for 5 days. So two tablets a day for 5 days. When I was trying to get my prostate-specific antigen down, it's a separate story, that one, but I used 12 milligrams a day for 7 weeks and had no side effects. Given that I've said it, I better tell you briefly what it is now, but my PSA was increased. So I thought, is my PSA increased because I got prostate cancer? Because at my age, that's not improbable. So I took some ivermectin every day for 7 weeks, no side effects at all. PSA didn't go down, and I think that's a possible indicator that I didn't have prostate cancer. Not that that's why I believe I didn't have prostate cancer. I had an MRI scan to demonstrate that. But the point is, I took one a day for 7 weeks with no side effects. But as we say, a lot of doctors are recommending 24 milligrams a day for people with COVID infection and potentially, as we'll see, with other viral infections. Of course, this is purely for educational purposes, not telling you what to do, but you know that by now. So multiple reports from in vitro infectious models document ivermectin's antiviral properties. This is really quite beyond dispute, really, and we'll look at some mechanisms if you hang around. Ivermectin has broad spectrum antiviral activity from this paper. So it's not just SARS coronavirus 2, it's a broad spectrum of viruses, particularly there's a condition called breakbone fever or dengue fever, which is, as the name implies, is agony. It feels like broken bones. Ivermectin is almost certainly effective against that and should be large-scale trials should be done on this. So this is a randomised double-blind placebo-controlled trial. Tick, tick, tick. That's all good. Single oral ivermectin dose as a prophylaxis for SARS coronavirus 2. Very small dose. Single dose. Trial to evaluate the effectiveness of a single low dose of ivermectin. And as we've seen, it is effective in some areas. Now, very low dose, as I've said. If someone was exposed to If I was exposed to SARS coronavirus 2 and want to prevent it, I would take a larger dose for a longer period of time. But even with this minimum dose, really very small dose, we're getting an effect indicating a potent anti-SARS coronavirus 2 viral activity, in my view. Ability to prevent SARS coronavirus 2 wasn't really known. Well, it is known. It is known. But this is the researchers are being modest. This is what they said they were investigating. Ability to reduce symptoms of infection did occur. Yes, it does do that, according to this study. Right, the method, asymptomatic community dwelling, adults enrolled within 72 hours of a close contact. Now, quite a few of these were, the tablet was given, the ivermectin was given within 24 hours, where you would expect it to be more effective. So a bit of a delay in some of them, not ideal there, but still giving useful information. Now, what dose did they give? Well, they gave a single dose of 200 micrograms per kilogram. So, for example, in a 65 kilogram woman, that would be 13 milligrams. Remember, these ones were 12 milligrams. So it'd be one of those and a tiny bit, I suppose. 80 kilogram man, they gave the equivalent of 16 milligrams. So again, less than the 24 milligrams that we'd probably take if I got it myself today. Primary outcome was, did people convert to a positive PCR or rapid antigen test within 14 days of close contact? Short answer to that is no, it didn't protect against that. Secondary outcome, which they also look for those who tested positive, days alive and free of symptoms, 14 and 28 days following ivermectin. Yes, it was effective for that. I'm going to give you some numbers on that just now. This is days from close contact until a positive polymerase chain reaction or rapid antigen test. Now, they originally recruited 536, 86 patients met the inclusion criteria, 68 adhered to the protocol and were admitted to the analysis. Small numbers, you would have got much better results with larger numbers, of course. But this is done in Australia, where the mood against ivermectin was pretty strong. So ivermectin arm 11 out of 36 tested positive, placebo arm 11 out of 32 tested positive. So we see with this small numbers, at least, we're not getting protection against the virus getting into the person. But we are getting other remarkably beneficial effects, which we're going to see now. So ivermectin did not prevent people testing positive, but days from close contact until a positive test were increased by 2.3 days in the ivermectin group. So people were taking much longer to test positive. The probability of that arising by chance was 3.3 out of 100, so that's a significant result. So ivermectin lengthened the incubation period, indicating it had an antiviral effect, and of course also potentially giving time for reinfection. It could have been that a lot of these patients were subject to a second antigenic challenge as they went along. So what this probably means is viral load needed to precipitate clinical disease took longer to develop. So the ivermectin was having an antiviral effect, taking it longer for the viral replication to reach the number of viral particles that made people sick, indicating an antiviral effect from ivermectin. Infection may have been prevented from a primary contact, indicating antiviral effect as well. As we said, time for a secondary contact to also infect the person, because this was 2021, where there was a lot of COVID around, and this was also the getting into the Omicron era as well, which of course is incredibly infectious. Days alive and symptom free increased by 2.5 days in the ivermectin group. Again, unlikely that result would arise by chance. It's a significant result. It's less than p equals 0.05. So ivermectin delayed the onset of symptoms in people who tested positive. Longer asymptomatic period, again indicating that the virus was being combated. Now we have to stress that this was with a very low dose. Had they carried on being given 24 milligrams for 2 or 3 days, probably most of these people would have got no symptoms at all. They would have had essentially asymptomatic infection. They would probably still have got infected, as we've seen. Or they may not. We don't know, because we haven't got big enough numbers really to adjudicate that. But it shows, in my mind, clearly the ivermectin was having a an antiviral effect, taking it longer for them to test positive, and keeping them healthy for a longer period of time, indicating an antiviral effect. Had they been given 12 milligrams a day for 3 or 4 days, as we say, probably have an even greater antiviral effect. So given this one dose, this is quite given this one dose, this is an incredible result actually, for one single dose. One dose. Amazing. It was never taken up by authorities around the world. Excuse me. Right. Controlling included, so they took account of age, prior SARS coronavirus 2 infection, body mass index, hypertension, lung disease, well-conducted study. Conclusion: we did not demonstrate that a single oral dose of low-dose ivermectin administered to people within 72 hours of close contact with a case of SARS coronavirus 2 prevented infection. So fair enough, didn't actually stop them getting infected. But we know, of course, that this is a disease that initially affects the mucosa. What it did do was stop them, prevent the disease escalating systemically, probably, because it's hard to see that anything really would prevent the infection getting into the respiratory mucosa. Anyway, with a larger sample it may have done. Of course, we don't know that. Amongst those who did convert to a positive PCR or rapid antigen test, ivermectin significantly lengthened the time from close contact to conversion. Ivermectin increased the number of days alive and free of symptoms, both indicating an antiviral effect. So there we are, quite convincing despite a really tiny dose, one single dose. Just think what could have been achieved in terms of life saved if this had been rolled out using a proper therapeutic dose. Quite incredible. Now I'm going to give you a few more details now for those that are interested. This trial initiated in 2021, so why the heck did it take so long? Open question. Ivermectin was discovered in 1975, massively used around the world. Over 3 billion people have had this drug. Won the Nobel Prize in 2015. This is not fringe stuff, discovered by Santoshi Amuro, developed by William Campbell. Very low incidence of serious adverse events. It's one of the world's safest drugs. In fact, the people that did have adverse events from this, what happened with most cases was that they took the ivermectin, and the ivermectin killed the parasites, and the parasites died, and the material from inside the parasites got out into the person's systemic circulation all at once. So it was like being injected with dead, mushed up parasite, which of course would cause adverse events, but that's an indication of how effective the ivermectin was at killing the parasites. We now know it's antiviral. Is it anti-cancer as well? Probably. Quite amazing. These natural drugs, because of course this is from a bacterium discovered near a golf course in Japan, they have multiple modalities of action. They work in lots and lots of different ways. They're not like man-made pharmaceuticals that have like one mechanism of action. They affect huge amounts of systems in the body, working in multiple ways. So you could put this two ways. God-made drugs work better than human-made drugs. Or you could say, depending on your worldview, that it's had a long time for evolutionary processes to perfect these molecules. But either way, these drugs have, these natural drugs very often have multiple modalities of action. So virtually no side effects. I had none personally. No instance of resistance over 25 years. This can go on serving humanity indefinitely into the future. Ivermectin can bind to inhibit the nuclear roles of host importing a alpha protein. Well, right, that's gobbledygook. So what this means is, of course, is in a cell you have the whole cell, and inside you have the nucleus. Now, material has to get from the cytoplasm into the nucleus, especially in a lot of viral infections, then from the nucleus back out, so that the cell can then make more viral particles, which are then exported from the surface of the cell. That would be a new virus. Now, what this means here is ivermectin can bind to inhibit the nuclear transport roles of host importin A. These proteins, if we imagine, let's draw a draw up of imagine that's the nucleus there. In actual fact, there's pores in the nuclear membrane like this. There's pores in it. And there's proteins guard the way in and the way out of there. So ivermectin will inhibit these, basically blocking these up. So normally the viral products will get into the nucleus, trigger their viral replication processes and get out again. But if it's blocked up, they can't. And that can work against a range of viruses that need to go into the nucleus as part of their reproductive cycle. So that's the way, one of the ways it's working. But there's many other possible mechanisms as well, because these natural molecules have so many ways that they can work. So this protein that's blocked up here is known to mediate the nuclear import of various viral proteins and key host factors. So it's blocking up the nucleus. Nucleus, of course, is where the chromosomes are. This is where the deoxyribonucleic acid is in the chromosomes of the cell. And it's stopping it going from the cytosol, the cytoplasm of the cell, into the nucleus, and from the nucleus out to the cytoplasm of the cell, therefore preventing viral replication. Makes perfect sense, actually. Other quite distinct antiviral actions of ivermectin have been proposed. High therapeutic concentrations collecting the lungs are stable for 30 days. Now, this is research from cattle, actually. So what happens is, what seems to happen here is that the ivermectin can be given in relatively low doses because it goes to the lungs and can be concentrated in the lungs. It can protect particularly against respiratory viral infections. Is it stable in human lungs for 30 days like it is in cattle lungs? We don't know. The studies have never been done. But if it's stable in cow lungs for 30 days, I imagine it's stable in human lungs for quite a reasonable period of time as well. And the concentrations that can occur, even with small doses, are sufficient to have this antiviral effect. That now seems pretty clear from the pharmacodynamics is how it works, and the pharmacokinetics is how long it will stick around for. So that evidence really is pretty well there now, I would have thought. Trial was based on strong clinical retrospective, as this is the trial we're talking about. Trial was based on the strong clinical retrospective association of statistically significant lower mortality in patients who received oral ivermectin, just 200 micrograms per kilogram, compared with the usual care. And that's actually the study that stimulated this seems to be this study here, from what I can gather. And it is pretty convincing. I'll just briefly tell you some of the outcomes of it. Ivermectin patients had 15% mortality in hospitalised patients. Non-ivermectin patients, 25.2% mortality. So ivermectin group, way less people dying. But in people with severe pulmonary disease, the mortality in the ivermectin group was 38.8. The mortality in the controls was 80.7. So only under 20% of the control surviving. And many other studies that show similar benefit. Let's leave the last word to Dr. Pierre Corey. This is his book here, War on Ivermectin. He says this: it's no longer a debatable fact that treating COVID with ivermectin leads to highly statistically significant improvements in time to viral clearance, time to clinical recovery, hospitalisation and death. Pretty clear, really, I would have thought. But in terms of prevention, he also says this: up until now, I've mostly been talking about treating COVID with ivermectin. I haven't even gotten to its enormous preventative prophylaxis capacities. Demonstration in 17 clinical trials, 4 randomised controlled trials and 1 propensity match study, 16 of the 17 trials produced not only large magnitude positive impacts but highly statistically significant ones as well. I have never in my career, Dr. Corey says, seen an evidence base this strong for any preventative therapeutic. So had it been used in the pandemic more fully, it could have prevented way more cases than the vaccines ever did. And it could have prevented a lot more patients from dying. And if we'd gone to English nursing homes and given them ivermectin instead of morphine and midazolam, the fatality of the pandemic due to iatrogenesis, deaths caused by medical treatment, would have been dramatically less, in my view. Not for me to tell you what you think. Look at the papers, look at the evidence. Tell me what you think. I'm convinced, and we need to know what the properties of ivermectin now are because of its multiple modalities of action against other viral infections and against other diseases such as cancer. In my view, it is unethical if these trials are not done. Don't forget, don't take anything based on what I say. This is just for education, but let me know what you think. That's what the comment section's for. Let's finish there before we get mad at all the unnecessary deaths. But for now, thank you for watching.